Good evening. Thank you for joining us. The number of available ICU beds in Mississippi is at a critical level, and it is the same or worse for other states in our region.
As our Stephanie Poole explains, medical professionals are trying their best to find spaces for critically ill patients. She joins us live in the studio with more.
Today, the Mississippi State Department of Health reports just over 2,000 new COVID-19 cases. Many of those will end up in the hospital, and of those, dozens will need intensive care. Hospitals across the South are dealing with a surge of the COVID-19 Delta variant.
As the country has experienced, we've seen it here in our ICU as well.
Bridget Alexander is the director of inpatient nursing at Baptist Memorial Hospital, Golden Triangle. With case numbers rising, room to treat critically ill patients is rapidly shrinking. On Thursday, health leaders announced only 8 intensive care unit beds were left in Mississippi.
Our capacity for CCU is 18 patients. We send 1 or 2 patients out, and that bed is taken pretty rapidly.
Just over 7,300 people in Lowndes County have tested positive for coronavirus since March 2020. However, Baptist isn't just treating folks from the Golden Triangle. Patients are traveling across state lines. Jim Craig, the senior deputy and state director of health protection, says rural medical facilities are transferring people weekly.
We're seeing some abnormal patterns of transfer. So if you would normally be transferred for an ICU 60 miles down the road, you may be transferred a lot further. You may be going to another part of the state. Right now, we're seeing probably more requests from out of state coming to Mississippi.
We have received several patients from different states, Arkansas, Missouri. So we have seen the influx. Our emergency department, we've gone from a volume of 160 patients to over 200 a day. So we have seen that influx of admissions as well.
This means hospitals report capacity numbers every few hours.
And we use the rotation process that we have to make ICU space available for those patients.
We have had transfers this week, last week. It's a constant transfer. We're constantly looking at where are the patients, where are our bed availabilities, what do we need to do with staffing to ensure our patients get optimum care.
Alexander tells me Baptist Memorial Hospital is also using their emergency room space for an ICU when needed.